In today's video, I will be going over the top 5 nursing interview questions and I will be providing answers. Hello, welcome to Nursing with Professor B. My name is Bridget. I'm a family nurse practitioner. My other video on the top 9 top nursing interview questions and answers has been seen over 30,000 times and has helped many nurses obtain a job. So I decided to do a follow-up video. This is a 2-part video series. Today I'll be going over 5 questions, and then in the next video I'll be going over an additional 5 questions. Let's get started. So one of the most common questions that interviewers ask is the question, tell me about yourself. I don't know about you, but personally, I don't like talking about myself. I'd rather hear what others have to say. I don't want to come across as arrogant or bragging, but you also don't want to come across like you lack confidence. Make sure that you look up the company's mission statement and you show how you fit into their mission with your skills. So things that you should not be doing is restate your resume, getting too personal, rambling. You don't want to talk about yourself for 5 minutes, 5 to 10 minutes, right? You're going to bore them. They have your resume in front. You don't have to just go bullet by bullet. They already have that. They want to know additional details. Here's an example of how you could answer this question. So this is from my personal life. I've been a nurse for 11 years and I've worked in a variety of specialties. I loved being part of a team whose mission was to heal the patient. I obtained my master's degree in nursing education because I love educating and I knew I wanted a role in mentoring the next generation of nurses. After working as a nurse for several years, I became passionate about health promotion and helping patients avoid coming to the hospital in the first place. I felt that as a nurse practitioner, I could educate patients that were on the brink of being diagnosed with conditions like diabetes and hypertension and/or high cholesterol, and discuss with them the importance of lifestyle changes and adhering to prescribed medications. My time at the hospital showed me what happens when patients wait too long to go to their healthcare provider, or if they don't comply with their medication regimen. I want to save patients from having end-stage renal disease, dialysis, amputations. My time as an NP has been very rewarding. I feel like I am challenged and I am making a difference. So that's just my little spiel. Now that because of COVID, you could type all this out and then take advantage of, if you have a phone interview first, you could, if you have it typed out, you could read it. Just make sure that you use inflection so you don't sound like you're reading. That's an example of how you could answer a question about tell me about yourself. Another question that nurse interviewers love to ask is, name a time you were in an ethical dilemma. So what interviewers are trying to do is they are trying to gauge your moral standards and they want to see if you took an ethical stance in your professional career. In this situation, a story that I have prepared is the one time that I had a patient that was in extreme pain and there was a provider there that day. So in the hospital, if you're a nurse or a nursing student, you're aware that doctors have a dictation room where they go and they chart and they dictate and all that, right? So there was a certain doctor there that was notorious for not being very nice. And he was occasionally in an awful mood. And when he was in an awful mood, you couldn't really talk to him. So that day he was in one of his moods. He got to the dictation room. He put a sign up on right above him that said, do not talk to me. Do not talk to me unless it's life or death. Well, unfortunately that day I had a patient that was in extreme pain. He had no medication on file. And I just could not see him there writhing in pain. Like, I felt like ethically it was my duty to advocate for him. I knew that if I went and asked the doctor for pain medication that he was going to yell at me, he was going to get upset. And sure enough, when I went to go speak to the doctor, I asked him, listen, this patient is in extreme pain. I really do need some pain medication. He said, is this a life or death situation? Were his exact words. I said, no, but I can't leave him there writhing in pain. So he mumbled and wasn't very happy. He did order the pain medication. So for this question, I would just say he wasn't very happy that I went and talked to him, but I advocated for my patient. And I would just end it there. I wouldn't go into the details of him being really upset and yelling. That's just extra superfluous details that you don't need to add. You can just add that you advocated for your patient and you were able to bring comfort to your patient. I always believe in being genuine, so don't take my answers as if they're your own. Just think of scenarios that you've been in and use them from your own life. What are 3 strengths that you have? So what you don't want to do is brag. You don't want to be like, I'm just the greatest. I mean, where do I start? Everything I do is phenomenal, right? You don't want to say that. So you want to be specific, give concrete examples. So for example, one strength of mine is that I like to be proactive. So for example, if I had a patient that's on a diuretic and I noticed that their potassium was 3.5 and they were not on the potassium protocol, then when the physician is rounding with me, I would ask for the potassium protocol because I see that their potassium is on the lower end, and if it dips any lower, we're going to have to intervene. That is one example of a strength, being proactive. Another skill is I like organization in order to maximize efficiency. So there's a quote by Abraham Lincoln that time changes, but it's often said that he said, if I had 6 hours to chop down a tree, I would spend the first 4 sharpening my axe. When I first started nursing, one day I felt like, okay, I need to organize my day. What can I do? So on my day off, I created a 1-page brain sheet that I used to fill the most important information about my patients. And my brain sheet has things such as the vitals, med times, blood glucose levels. By the way, if you want my brain sheet, it's on Etsy. So you can go to my store on Etsy. But anyways, so that I could quickly access the information and also be able to complete the tasks that I needed to do for the day. And that brain sheet changed my life. Like I could get my day organized, and I knew if a physician was running, I could say, listen, I need this, this, and this. I knew if I had done the Braden scale for patients, the Moore scale, it really was worth it. And I used that brain sheet every day. When I first got to work, I organized my day. I would get there early. I would look up my patients. I would look up their labs. I would look up their med times, write it all down. And then my day just flowed a lot better. Is nursing easy even when you're organized? No, but it's a heck of a lot easier than you don't have any type of organizational skills. And then you start your day and you went to, I'm sure you have done this, whether in clinical or in nursing, right? Then you just went into a patient room, you left, and then you realize you forgot to give them a medication. So now you have to go back to the Pyxis. Let's say that there's a long line because it's peak medication administration time. Now you're waiting for the Pyxis. Then you have to go through the whole shebang. Instead of, if you bundled your care, you could have just gone in at once and taking care of it, boom, boom, bam, right? Another strength that you could say that you have is that you're calm under pressure. So of course, remember, this has to be real. Like if you are not calm under pressure, then don't say that. But an example that I would give is when I worked in psych, I very quickly realized that patients, they feed off of your energy. They feed off of your tone of voice and behavior. So it made me learn when patients were agitated, I could de-escalate a situation by speaking to them in a calm tone, listening to them, acknowledging their concerns. Another strength that you could say is that you have the strength of positivity, that you try to maintain a positive outlook even when things get difficult, which is admirable because not everybody has that strength. And if you have someone that's on the unit that's positive, I don't know if you've worked around people that just drain your energy, but also if you've worked around people that they're always happy no matter what. And I've worked with both types of people, and I'd rather work with a person that's always bright and smiling and happy and just brings the morale up. Question number 4 is, could ask different way, right? It could be, what is a weakness that you have? Name a weakness. Or what is a weakness a friend might say you have? If you're a new grad, this is a huge opportunity. Like I wouldn't say a weakness that is detrimental to what you actually do. Like I'm an introvert, right? But I don't think it's in my best interest to say I'm an introvert because people mistakenly believe that being an introvert means you're shy. I'm not shy. So I would not go with I'm an introvert or I'm shy, because think if you're applying for a job in retail and you say you're not a people person, they're not going to hire you. So your weakness has to be a weakness that's not going to automatically disqualify you. So if you're a new grad, go with lack of experience. A weakness that I have is lack of experience. Then you can talk about all of the clinical hours that you have under your belt. And I would use that as an opportunity. I may not have experience, but that also makes me open to being trained and to not have learned bad habits. I'm open to learning things the correct way, the way you want them done on your unit. Another weakness that you may say that actually is a positive in nursing is that sometimes you focus too much on the details. So you can say something like, at times I get too hyper focused and I need to step back and look at the big picture. I'm working on this by sometimes not getting so bogged down in the details and taking a step back. Another one you could say that is a weakness could be time management. I try to treat each patient as if they are my only patient, and sometimes this makes me fall behind. I am working on it by creating my brain sheet, by setting timers for myself, and letting patients know that I can spend the next 5 minutes with them, but then need to go round on my other patients. So you want to create a plan. You say your weakness, but then you say how you're improving on it. And that puts a positive spin on it. Another weakness you could say is that you're too task oriented. Sometimes I am so focused on completing all my charting, med passes, that I forget to take a break. This is me. This is me when I was a nurse, and this is probably why I left bedside, because bedside is hard. I mean, I need to do a video on just the dire situation that as nurses we experience. I don't think that there's another profession that pretty much puts up with all that we put up. It's ridiculous. But that being said, I would not feel a lot of times comfortable taking a break as a nurse because I do have issues with letting go of control, because I feel like if I don't do it, someone else isn't going to do it right. And that's something that I need to work on. I acknowledge that. But when I was a nurse, I just felt like even sometimes when I would pass my phone to someone or try to turn my phone off and a patient called, inevitably, like that person was busy, the nurse that was supposed to cover me, they wouldn't go to that patient's room. And I just don't have the heart to leave a patient. Like, I have interstitial cystitis. So when I have to go to the bathroom, I have to go to the bathroom. And I just didn't have it in my heart to like leave a patient that had to go to the bathroom. I was worried that maybe they would try to go to the bathroom and they would be a fall risk and they would fall. So I pretty much, when I went to work, I just knew mentally like those 12 hours, I was just going to go, 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 go. I would try to, of course, I would take my bathroom breaks, my sips of water. I would take my little granola bars in my pocket, but I just wanted to be on time, not get behind. So that is one that actually is applicable to me. That's a weakness of mine. It's like, I need to complete all my tasks. I'm gonna definitely like work now, play later. But with nursing, you need to pace yourself, and I wasn't good at that. Another weakness that you could say is being too self-critical. I hold myself to a high standard, especially because patients' lives are in our hands. I'm working on this by realizing that in nursing, we learn something new every day, and we can't know everything or be perfect 100% of the time. And then the last question I will cover today is, why did you become a nurse? Or they may ask you like, did something happen in your childhood, or were you inspired by a family member? So my way into nursing was very roundabout. Being a nurse was not like my childhood dream, but I wouldn't say that in an interview. If it was your childhood dream, then go for it. So this answer, I pretty much just was thinking, brainstorming, like, what can I say? And then I thought about this. Remember, you always do want to have some authenticity in it. So I wrote, my uncle is a physician in Colombia, and growing up, I always admired him and his ability to heal and make people feel better. When I grew up, I knew I wanted to make an impact. I loved how as nurses, we are at the front lines of patient care. We do so many things, but part of what makes being a nurse great is advocating for your patient, holding their hand when they're lonely or scared, educating them on their condition so that they can get better and not have to return to the hospital. Being there for them in their time of need and keeping them safe by monitoring their condition and recommending changes that need to be made to the healthcare provider. Being a patient advocate and educating patients is extremely important. Those are 5 extremely common nursing interview questions that they do ask. Leave a comment below if this video helped you. Make sure that you hit the like button, you subscribe, and you turn on the notification bell if you found value in this video. Until next time.